Hi, I'm Dr. Lawrence Robinson, and I'm one of the attending physicians here at Ear, Nose, Throat, and Allergy Specialists. Sinusitis is inflammation of the sinuses, and it can be caused by infection, it can be caused by allergies, it can also be caused by anatomical issues where your sinuses aren't draining appropriately. Sinusitis can be an acute infection, which typically is anywhere between 2 to 4 weeks of symptoms, or it can be chronic, and chronic sinusitis is typically where you have symptoms for 2 months or greater. Most patients are referred to us by their primary care physician. However, we also have patients that walk in with bad sinuses. So any patient can see an ENT that has sinus symptoms, and we typically treat acute sinusitis with medication, either antibiotics if we think it's a bacterial infection, or decongestants, nasal steroid sprays, saline irrigations, and typically most people will clear with that treatment. However, some patients go on to have either recurrent acute sinusitis or chronic sinusitis, and those typically require a little bit more complex treatment. Most patients do not require surgery. Most patients can be managed medically. Most patients can be managed, as I mentioned before, with antibiotics, nasal irrigation, decongestants. Most patients can be managed oftentimes sinusitis is caused by some underlying component such as allergies. And typically if we can manage patients' allergies, they don't go on to need any surgery. Surgery is reserved for patients who fail medical management. The non-surgical treatments that are available include first off, we typically recommend allergy testing for patients, and if patients have allergies, in this practice, we try to treat allergies very aggressively. Allergies can be treated with medication, there's pharmacological treatment, and there's also immunotherapy. Immunotherapy is the only known way to quote-unquote cure a patient of their allergies. And what that is basically desensitizing the immune system to overreacting to stimuli that stimulate the allergic response. We also treat sinusitis for patients that don't have allergies with medication. Typically, chronic sinusitis is treated with anywhere between 3 to 6 week course of antibiotics, maybe a course of steroids, nasal steroid, decongestants. And if a patient does not respond to medical treatment, that's where we go on to surgical treatments. Surgical treatments have to be tailored to the individual patient. Their sinus surgery is not a one-size-fits-all for patients. We do imaging on patients, and we actually have the ability to do CT imaging in our office, or a patient may have had a CT performed by their primary care physician or at a hospital. And the extent of surgery depends on the severity of disease as is defined by the CT scan. So FES is an old colloquial term, and the acronym stands for Functional Endoscopic Sinus Surgery. And the reason why it's called functional is several years ago, in the generation before myself, ENT surgeons performed very maximally invasive procedures on the sinuses because it was thought that if a patient had a sinus infection, the sinuses are essentially caves in our skull and in our face, and they fill up with fluid, or if there can be inflammation. And it was once thought that if those caves are opened up as widely as possible, that it would help prevent patients from having symptoms with sinusitis. Well, it was learned that that was not the case. And so in the 90s, early 2000s, we really developed the use of endoscopes to treat sinusitis in a minimally invasive fashion, because we realized that the goal of sinus surgery was not to make as large of an opening in the sinuses as possible, but it was to restore the natural drainage of the sinuses. And that's what functional endoscopic sinus surgery accomplishes. Some patients require very minimally invasive surgery if they only have one blocked sinus, for instance. And that patient can even be treated in the office with a minimally invasive procedure, such as with the balloon sinuplasty procedure. Those patients can go on to do their normal activities either later that day or the next day. If a patient does require an endoscopic sinus surgery under general anesthesia, Those patients typically require a little bit longer period of recovery. However, with the techniques that we employ, we try to be as minimally invasive as possible. We don't pack the nose like we used to do in the past. And most patients, if patients, have an office job or they don't do a lot of strenuous activity in their job, they may be able to get back to work after just a weekend of recovery. Patients who do a lot of heavy lifting, strenuous activity, those patients, we usually have them take about a week off of work.